So the next set of questions is PSGN based one question was there. The answer was, the answer was PSGN or the answer was RBC cast. I'm not really sure on that, but there was one question. And when will we? There is this controversial question on RRT. When will we initiate the dialysis in patients with CKD? Actually, the discussion with the family will begin once when the GFR drops to less than 30, and you will initiate the process of RRT once the GFR is between less than 10 to 15, but the option did not have 15. This is one controversial question. I don't know what the board members expected out of us. Next question was based on post HSCT transplant. There was raised liver enzymes, pain, abdomen, and all of that. That was because of that sinusoidal obstruction syndrome. And next was one hypopituitarism patient was there, and hyperechoplexia clinical scenario was given. And HOCM, which drug we use, propranolol, and one clinical scenario wherein there will be V's and all, basically a vascular ring kind of a thing that they expected, which is the most common cause of it. Again, this is a little controversial because there was one answer showing a left aberrant artery that can cause impingement and cause all of this, and one more option was a right side aortic arch. As per Nelson, the most common cause of vascular ring is double aortic arch, and second most common will be right aortic arch, but that is with the left aberrant subclavian artery, right aortic arch with left subclavian aberrant artery. So I do not know what is the answer. And next one more question was based on AS. The answer is valvular form associated with stenosis was the answer. And one question wherein a neonatal age baby presenting in shock, that was HLHS. One question, the physiological and pathophysiology in clinical scenario was given, that was tricuspid atresia was there, and one ECG with the strain pattern and the ST segment depression and T wave inversion and all those things was given, Al Kappa. And a child, a 10-year-old child with multiple clicks, answer is Epstein's. I made a mistake. Okay, and there was one question with PSVT which shocked this again. The thing is, in PALS, what they have given is children with poor perfusion. Initial thing will be to give adenosine only. If there is a IV access, provided if there is no IV access or if the adenosine is not effective, only then the option of synchronized cardioversion comes there. Question wherein if a pediatric age group ECG looks like an adult ECG, then what do you infer? It just infers left ventricular hypertension, hypertrophy basically. And one question of top was there. The answer is Tetzpel is an indication for surgery. One question on foramen ovale, that is, it is basically this thing between septum primum and second opening, and RDS surfact patient worsening on FiO2 of 30, so they had to increase up to 45%, that was given. So the answer is surfactant administration. TTNB, all one X-ray suggestive of TNB. No, in TTNB, what will be the X-ray suggestion? Something like that. One question was there. All can result in whiteout lung except that is unobstructed TAPVC is the answer. One more question wherein based on NRP, labored breathing happens after the initial steps. So what is the thing that you do in a preterm? CPAP we give.